Hi, I'm Jennifer Coffey, and tomorrow I'm going to see my family practice doctor because I've had some really different and bad symptoms recently. I've had a lot of nausea, vomiting, I've had a lot of headaches, and I've been very fatigued and tired. I want to sleep all the time, and I think that there's something going on with me that's out of the norm. I am actually epileptic, so I'm used to seizures, but recently I've had a lot more than normal, and I'm currently on my epilepsy medication, so I don't think that it's because of that. And so I've actually fallen and had a lot of memory loss, and so I think that I possibly could have hit my head really hard during one of my episodes, and so I'm going to go see my family practice doctor tomorrow and figure out what's wrong with me.
Hi, I'm Dr. Bond, and I'm the family doctor for Jennifer Coffey. It is my job to research other illnesses associated with Jennifer's illness and run diagnostics tests to determine the exact cause of her disease and provide treatment options. Alright, we'll get you situated up here in exam room A. I'll be back in a few minutes, okay?
Okay, I'll just
Get
sit
comfortable.
here. Wait.
How have you been feeling?
Well, I've been a little weak lately, fatigued. Sometimes I have really a lot of trouble remembering things, like really easy things to remember, such as today when I was supposed to come see you.
Okay.
It's been a real struggle lately, Dr. Bond.
Okay, well I'm looking through your medical records and I noticed that you have, you're epileptic.
I am, and that's been getting a lot worse recently.
Have you had any incidences, like have you fallen recently?
Yes, I fall a lot, and then I get up and I don't remember where I am.
Alright, we're going to start your physical exam now. I'm going to take your blood pressure. Okay, I'm going to check your heart now.
Okay.
Alright, now I'm going to check your reflexes, see how those are. Do you feel is this triggering anything?
No, I mean, I definitely feel it, but no response.
Let's try the other one. Alright, just be real relaxed, okay? Still no reflexes?
Mm-hmm.
It's odd. Alright, I'm gonna just test some basic memory skills here, see how your thought process is working. So why don't you start off by telling me what you did yesterday?
Okay, well, so yesterday I got up and I had some breakfast and I made sure all the kids got to school on time.
And how many kids do you have?
I have 6. Little Johnny. I have such a great age right now. So then later that day, I did some cleaning, some cooking. I didn't have to go to work yesterday. Really relaxed day. Was getting ready to see you. Made sure I had all my plans, what to tell you. What's been going on.
Mm-hmm.
I had dinner with my husband. Had a really nice dinner. Make sure the kids were home. Simple day for me.
I'm sorry, I don't mean to pry or anything, but where's your wedding ring?
Oh no. Oh, I must have forgotten it today. That's so weird. See, I don't normally do that.
Alright, well I'm still slightly concerned and I cannot definitely say what exactly is going on. I'm going to go out on a limb here and assume that you have a subdural hematoma from your continuous falls on your head from your epilepsy.
Okay.
But I'm going to refer you to Dr. Smith, who is our radiologist, and he'll run a CT scan.
Okay, that sounds good.
Hi Jennifer, I'm Dr. Smith, your radiologist. Nice to meet you.
Nice to meet you.
So I was looking over the results your family doctor, Dr. Bond, had given me, and your test results, they seemed a little bit iffy to me, so I'm going to actually refer you to my oncologist, and she's going to perform the CT scan.
Oh, goodness. Okay, so we don't think it's a subdural hematoma anymore?
Based on my information that I've got from your family doctor, I think we just need to go straight to the, take the safest route and go straight to the oncologist.
Okay, so basically we're looking at the worst and hoping it's better.
Exactly.
Hi, I'm John Pierce and I'm Jennifer Coffey's insurance agent. Hi, Miss Coffey. It's nice to see you
Hey, John.
today.
How's it going?
It's going well. How are you?
Good. A little upset.
What exactly has been
Some
going
medical
on?
stuff going on, lots of problems recently.
Okay.
So that's why I'm checking in with you, seeing if I'm covered for all my expenses.
Okay, well, what exactly is going on?
So I've seen my family practice doctor. He sent me to a radiologist, and he said that possibly I'm gonna need a biopsy. So I'll need a pathologist and maybe even an oncologist if they decide that I have cancer. So I need a CT, blood work, all this kind of stuff. So do you think I'm gonna be covered for everything?
Well, the good thing about the plan you're under right now is it's called Blue Choice Platinum. And this plan, basically, the most amount of money for your covered services you're gonna have to pay is $4,000 in 1 year. So that's great news for you. You guys, you really prepared for this. And really, the only things you're gonna have to pay co-insurance for is if you go to someone who's not in our network. So let's say you go out of state and you go to someone who's a specialist with what you're dealing with, and you're gonna have to pay 20% of those costs. Maybe, that might be, that can be expensive, but the good thing is that when you go to these doctors over and over, because I'm sure with cancer, you're gonna have to be going there, going home, going back. All those things will be covered. So you're really in a good place as far as this insurance goes, and I really hope everything goes super well. Now, one thing you need to make sure of is I'm gonna hand you a packet, and it's gonna give you a list of things that are covered, and it's gonna give you a list of places that are in our network, so you make sure you get the cheapest way you're going through this whole ordeal. But basically it's all included. Now, one thing you need to make sure of is that diagnostic tests, imaging, things like that, as long as you're in the network, you'll be fine. It'll be going to that out-of-pocket limit, and once you're at 4,000, there'll be nothing more than that. So really you're good. Make sure you let me know if you have any more questions. That's just a general overview, and I hope everything goes well, and I hope you get better soon.
Thank you so much, John.
Thank you. It's great seeing you
Yeah,
today.
you too.
Hi, I'm Dr. Calloway, and I'm Jennifer Coffey's oncologist. It's my job to research treatments of the type of cancer she has, in this case, brain cancer, a glioblastoma, and to do prognosis and tests to run. Okay, so the first thing normally done for a brain cancer is to relieve the pressure on the brain through surgery and to take out as much of the tumor as possible. Following that, we'll go through radiation and chemotherapy. Another thing is corticosteroids are used to lower the swelling all around, and that can also relieve a lot of pain that the patient can have. And then we'll also use anti-seizure medicines to help treat that.
Alright, so hello, I'm Jennifer Coffey's pathologist, Dr. Thompson, and today I have been looking at her biopsy from the tumor in her brain. So, as the oncologist and the radiologist thought, it is a glioblastoma grade 4. I determined that by looking at the different types of cells and noticing how abnormal they look compared to the regular astrocytes. And so I've determined that the tumor is about 7 centimeters in diameter and that it has positive margins, meaning that the cancer cells are found at the edge of the material that's going to be removed. And so we've only done the one biopsy, but it's given us a very definitive view of the malignant cells. So now it's up to her oncologist to give her the appropriate treatment. I'll send her the pathology report, and they will go from there in Mrs. Coffey's treatment.
Hi Jennifer, thanks for meeting with us. We have the results from your CT scan and the pathology report from your biopsy. And, there's no easy way to put this, but based on your results, you have a glioblastoma in the frontal lobe of your cerebrum.
Okay, so... Oh, wow.
Yeah, and it is grade 4, and since it is a glioblastoma, that means that the tumor has blood vessel growth and areas of dead cells in addition to symptoms and signs that you would normally see in a grade 2 and grade 3 cancer tumor. Here I am with my patient, Jennifer Coffey. You can go ahead and do that. Glioblastomas can be very difficult to treat because the tumors contain so many different types of cells. The approach to this type of cancer can take several different types of treatments. One being a CT scan to get a better image of the tumor itself. That's why we're here today, so that she can get her scan and we can see what we're working with.
So, what cells in my brain are those attacking exactly?
It's attacking the astrocytes in your brain, and those are the supportive tissue of the brain, and it really attacks those really aggressively. So
Mhm.
it's
It's very deep into the tissues. They're very, very difficult to get out because they have all those connections into major vessels in your brain. It is reoccurring also, so we're gonna have to really watch it. Even if we do get you into remission, it will come back.
Types of treatment, the relative amount of time I could live is different, but I'm trying to keep it in the moment.
Yeah, absolutely. And I think it's really important for you to keep in mind that brain tumors cause major physical and mental changes in your body, and that you're going to be experiencing different things. Have you had any changes in self-esteem? Have you been feeling bad about yourself lately?
Not necessarily bad about myself, but just, disappointed with my prognosis.
One thing to be really careful with is a lot of patients who are diagnosed with cancer start to distance themselves from their close friends and family, and it's really important for you to know that they're there to help and they want to support you. And you really need to be able to open up and let them come and give you that love and support, because that will help you so much as you go through your treatments.
I know, but I feel like they just don't understand, what I'm going through, and that they're just not as helpful as they think. They treat me
Absolutely.
like I'm less than them, and they treat me like they need to be careful around me in everything they do, and I may act a little bit different, but I'm still the same person, and
Yeah, absolutely.
it's hard for them to deal with that.
One of the major mental changes that can come are things that bring along the same symptoms as fear and anxiety. So a lot of this, you're going to be extra sensitive to how people are reacting around you. Different people definitely deal with things differently, but it's really important for you not to be hesitant to tell people how you want to be treated. And if you do feel that one of your close friends or family members is starting to treat you differently, it's okay to say, hey, listen, I'm okay. Like, you don't have to talk to me differently. You don't have to be careful around me. Because they just, honestly, they are in the same position with you, as in they don't know how to deal with this. It's just as new and scary for them as it is for you.
Exactly, but when you think about it, they're not the ones that are going to die.
Right, and it's good for you to know that social workers can help you with information about your entitlements to sick pay and benefits. And I would be happy to refer you to different support groups and doctors. They have groups for people who are going through the exact same type of cancer as you. And sometimes it's really good to get their input on how they're coping and dealing with it also.
Yeah, I think that's a really good idea. Talking to someone who is going through the same thing I am would probably help me cope a little bit better. Also, at this time, it's hard to stay with my friends because like I said, I don't think they understand me, and being with someone who understands me, I feel like I could let loose and have a little bit more fun.
Right. Yeah, I would absolutely love to refer you to a group, and I for sure will do that. And why don't we plan on meeting at least once a week, just so I can stay in touch and we can make sure everything's going all right.
I think that sounds great, Dr. Brown.
It was so nice to meet you.
You too.
So, Dr. Cowboy, what exactly are we doing here?
Well, right now we're going through one of our chemo treatments. This is done to help slow and stop the growth of the tumor itself. Because of the blood-brain barrier that the body uses to protect the brain and spinal cord from harmful chemicals, sometimes it's hard for this medicine to get through to work. That's why we're also going to go through radiation to help make sure we stop that angiogenesis process of creating new blood vessels.
Okay, so do you really think this is going to work though?
I think it will be helpful to your treatment because of the type of cancer you have, the glioblastoma. There's a lot of different types of cells in the specific tumor, so it's really hard to tell how effective the treatment will be, and we have to use lots of different types of treatments to really get a good prognosis.